Good afternoon, and welcome to Forever Young Med Spa's Simple Aesthetics radio show, where for the next hour, we will seek to demystify the world of aesthetics and provide to you, our listening audience, a non-medical opinion on what's hot, what's not, and what works based on our experience of performing over 22,000 treatments since 2005. The views provided on this show should not be considered medical advice, but rather the opinion of the host who has been in the medical aesthetics business since 2005. During this program, we will highlight some of the best new and tried and proven FDA-approved services and go over the technology, how and why it works, results you can expect, and take your questions live on the air. If you have a question you'd rather email, please send it to brian@foreveryoungmedspa.us. And now, here's your host, Brian Sedella.
Good afternoon, South Florida. Welcome back to another Simple Aesthetics radio show. And I've been gone the past few weeks, so I don't know if you missed me, but I missed doing the show. And want to thank everyone for tuning in. And I know one week, might have been last week, that we actually had at the station a transformer blow, so the show didn't broadcast at all. And I've been gone the past few weeks, had a family emergency that I'm going to talk about a little bit. You know, you never know in life what's going to happen day to day. And a couple weeks ago, I guess it was a few hours after the show, actually got home, and our youngest son, Diane, and our youngest son, Alex, has a condition called Coach syndrome. That's C-O-A-C-H, and it's a very rare syndrome. And the primary effect of the syndrome is that the child or the children are born with a fibrotic liver. At least most of them have that. That could also involve the kidneys, but Alex our youngest son, was born with a fibrotic liver. And we've been dealing with that for quite some time. He's now 23. And we knew the possibilities always existed. And let me back up. When you have a fibrotic liver, that means you have scarring in the liver. And that scarring prevents the blood flow from properly moving in and out of the liver because of the scarring. So that creates stresses on the other areas, such as the spleen, the esophagus, and the stomach. So his pressure got very, very high, unknown to us. And that night after the show, he began to vomit blood, which is a very, very scary condition, very, very scary sight to see. I hope no one ever has to see that, because it's definitely something scary. And my son was amazing. Alex was amazing in remaining calm. Mom and dad remained calm. We called the ambulance, went to the hospital, and make a long story short, he spent a couple of days in the ICU and then a week in the hospital, and thankfully he's doing much better. But the experience, when you have something as scary as that, was very, maybe not eye-opening is a good word, but it's so nice to know who your friends are in life. My wife was absolutely a bedrock, just amazing in how she handled this, virtually living at the hospital the entire week. Our oldest son, Nick, came down from college. The office staffs of the law offices of Diana Santa Maria and Forever Young Med Spa were spectacular, and picking up the slack and letting us do what we need to do, visiting us when we needed, just helping out in any way they can. So just a special thank you. Friends that kind of haven't maybe spoken to in quite a while, haven't seen in years, all of a sudden start showing up. Whenever you least expect it, there'd be someone at the door saying, "Hey, you okay? Anything I can do?" It's so nice to have friends and family that care enough to call, to write, to Facebook, to text, to come by, and I just want to thank everyone for doing that. Also, the doctors were wonderful at Memorial Hospital West, and Alex was part of a program at the National Institute of Health in Washington, D.C. There's about 100 to 120 kids nationwide that have the condition that he has. And if you've never been to the NIH, It's the way medicine should be practiced, where they spend days with each patient going through everything and anything to do with illness. And it was an amazing experience. We spent a week there, I think about 4 years ago. And one doctor in particular, Dr. Heller, was just amazing and is just amazing. Any question we had, day or night, he was there to answer, kind of what are the next steps now that we've been through this. And we're still evaluating what those next steps are. But just an amazing facility, wonderful, caring people at the NIH. It just showed me and has shown me that not all government programs are bad. The NIH is funded by the government and is truly a miraculous place to visit. And the research they do is invaluable for all sorts of diseases and disorders. And Koch syndrome is now one of those disorders that they're following and trying to come up with treatments. And lastly, before we move on to the segment, I want to say a special shout out to my son, Alex, who was heroic in what he went through. Alex, you're my hero. No kid should ever have to go through all you've gone through in your life. And I was not just me, Mom and Dad are very, very proud of you in what you've done. And the courage you showed was truly something that I will never forget. I love you. Okay, so now on to the show. And a lot to talk about. And before we get to that, I'm going to talk about our next 2 weeks of shows, because I have a special guest next week. I'm going to have to shuffle paper. There's a technique for injectables that is the only patented technique ever awarded by the U.S. Patent Office, which it has to be unique to get a patent. I mean, just trademarking of a name is one thing, but getting a patent on a technique when there are tens and thousands, maybe even hundreds of thousands of people injecting medical aesthetics in the U.S. And that technique and that procedure is called the ArcDerma Restoration Lift. And we're going to have on the inventor of that lift next week. Our own Livia Manor, who's our nurse practitioner, has been going through the didactic or the written part of that protocol for the past few months, and is now undertaking the actual hands-on physical training in the next 2 weeks, which is why she's out of the office. And when she comes back, we'll be offering this amazing technique. Again, the only technique ever granted a U.S. patent. And why? It's a new concept of blanketing thin strands of filler product, primarily hyaluronic acid-based products like Restylane and Juvederm, in strategic multi-direction vectors to create an artistic lift of lax tissue. It's a far more advanced and exact method of remodeling and lifting every area of the facial sculpture that is not possible with any other method. So we're going to have her on next week. And as a lot of you know, I spend a ton of my time evaluating new products and new services. And we have at Forever Young Med Spa now 5 different body contouring, non-surgical body contouring, and non-surgical skin tightening systems that we have. And I'm always asked the question, why? My own staff asked me why. And Dr. LaGrasso, who's our medical director, you may recall, now has his own radio program on Friday evenings on KTLA in Los Angeles. And he asked me to put together kind of a primer on why this different RF technology exists. I'm going to get that to in a second. So the 5 different systems we have are the Axillus Elite, the Venus Freeze, the VeloShape, the Vanquish, and the Venus Legacy. The Venus Legacy and the Venus Freeze are our 2 newest systems. We just brought them on 2 weeks ago. And I had evaluated the Venus system some 4 or 5 years ago and chose the Axillus Elite over that at that time, now going back 2 years, and had not really paid much attention to the company in that time. Well, they've come out with a new version of the Venus Freeze and an all-new platform called the Venus Legacy. And believe me, the last thing I wanted to do was make another 6-figure investment in this technology. But the results were so profound, so fantastic, And the patients, we actually started using this on patients a few months ago because we were also comparing another device called the VeloShape 3, which is all new as well, and kind of wanted to find out what is the best system. So we put them up head to head and had our patients tell us which one they like better, why, measure results, measured, the feedback. And every single patient that went through the Venus, Legacy, and Freeze came back out and said over and over and over again, you have to buy this system. I must have heard that 18 times. And I don't think I've ever heard that before in the practice, over and over again. So we bought that. And now we're going to talk about why we have so many different RF devices and why it's important. And in addition to the RF devices, as many of you know, Dr. LoGrasso offers surgical services for body contouring and skin tightening. So those include Vaser body shaping, Vaser high definition body sculpting, Vaser smooth for cellulite reduction, Vaser male chest reduction or sculpting, combination tummy tuck and Vaser body shaping, and the most popular procedure, probably he does probably more of this than anything else, is the Brazilian butt lift with fat transfer using Vaser. So now we're going to talk about something that hopefully you won't find too boring. And this is the presentation that we're going to be going through live on Friday on Dr. LoGrasso's show. But when I put this together, I thought, I think people need to understand why, Forever Young Med Spa has spent the hundreds and hundreds of thousands of dollars on this equipment and why we have now 5 different RF devices. So let's start with the number one and most popular device is a monopolar or unipolar radio frequency. And as you can probably imagine, a monopolar device uses one pole or one electrode, if you will. And out of that electrode comes the radio frequency energy. Typically in monopolar devices, you also have a grounding pad. And our monopolar device that we use is called the Axillus Elite. But it also adds something called Peltier cooling, which simply means we can adjust the temperature of the cooling to affect the different layers of the skin for skin tightening, and also the different layers of fat, because fat doesn't just come in one layer, it can be multiple millimeters thick. And the Peltier cooling allows us to adjust that cooling, because every patient's different, so that we can target the different levels and layers of fat. Now, monopolar devices typically have no downtime, and the depth of penetration is typically for the skin, for skin tightening, 1 to 5 millimeters deep, and for body contouring, 5 to 25 to 30 millimeters deep. So that's how the monopolar device works. And Freddie, if you could bring up the first picture, I can show you all an image. Again, if you're on the radio and if you'd like to go to the website, that's www.nnradio.com, you can actually see these pictures as well. And if you're on the radio now, you can always go back later. This will be on that program or that station later tonight, and you can watch these images. So the first image that you're seeing is the large handpiece for the Axillus Elite, and to the right is a small handpiece. The small handpiece is for skin tightening. The large handpiece is for either skin tightening, but primarily for body contouring. And you see there's only one pole or one stick, if you will, coming out of those devices. And that's why it's called a monopolar or unipolar device. Okay, we're going to take a short break. We're at the 15-minute segment. We'll come back in a few minutes and get to the rest of this presentation. We'll see you after the break. Thank you.
Turn back the hands of time with South Florida's #1 medical aesthetics center, Forever Young Med Spa. Have you ever wished you could turn back the hands of time? Lose those lines and wrinkles and enjoy the healthy, flawless skin you had during your younger years? Ever wanted to rid yourself from hair under your arms, on your legs, or around your bikini area? Or men, the hair on your backs? Well, now you can. at Forever Young Med Spa, where we provide the latest surgical and non-surgical procedures and rejuvenation products to restore your youthful skin appearance and enhance your self-image. Under the direction of renowned board-certified plastic surgeon Dr. Jeffrey Lagrasso, our staff of highly trained and certified professionals will meet with you to go over your goals and recommend services that best fit your lifestyle, your budget, and your expectations. So no matter if you're looking for surgical procedures such as Vaser high-definition body sculpting, a mommy makeover, or non-surgical services such as the latest FDA-approved injectables, Vanquish body contouring, Exilis Elite for skin tightening, or our Hydrafacial MD treatment for your face, you can relax and let Forever Young Med Spa complete your journey towards a younger, more vibrant-looking you. Call us now and schedule a complimentary consultation at 954-450-2626. That's 954-450-2626. Or for more information on all our services, please visit our website, www.foreveryoungmedspa.us.
Good afternoon. Welcome back. So we've talked about the monopolar or unipolar radio frequency. And by the way, all these devices work to some extent. Usually 60 to 70% is our threshold of pain to making sure we bring a device in that at least addresses 60 to 70% of the population. And one reason we have 5 devices is that we have found since 2005, we've been doing radio frequency since 2005. It's become the darling now, but we have just a ton of experience, and we know that combining these devices often yields even better results. So it's not unusual for us to combine 2 and possibly even 3 different devices in a patient protocol to achieve the best results possible. And again, the caveat of this is the practice of medicine. Nothing is ever 100%. And I'm going to go into that in a little bit later in the presentation, but these devices are medical devices costing $80,000 to $120,000, $30,000. And they're not toys. They're very expensive, very technologically advanced devices that take a lot of training to understand and use. And anyway, so we're going to get into that a little bit later on. But the next type of radio frequency technology is called bipolar. And bipolar delivers electricity and microcurrent between 2 or more poles, but only 2 at a time. So if you can picture 2 poles up, or 2 pencils up, the electrodes and the energy is flowing between those 2 poles. If you had 4, it's going between 2 at a time. If you had 6, it's going between 2 at a time. Most commonly, there's only 2 poles. Now, what's different about the bipolar energy is that it can also provide ablation of the skin, which leads to improvement in tone and texture, and also coagulation of tissues under the skin. And I'm going to show that in a second. Actually, Freddie, if you could bring up the next slide. No, go back one, please. And back one more, right there. So on the screen, you can see there's 2 different pictures. The far left is of a tip for the E-Matrix or the Matrix RF from Syneron. We actually had Dave Wald on the show a few weeks ago, and he talked about this technology. And it's hard to see, but that tip has 100+ little tiny dots on it. Each one of those dots represents a bipolar signature, if you will. Now, the next picture is of that inverted pyramid. No, same one, Freddie. Same picture, just I'm going to the right-hand side. And you can see an inverted pyramid and a pyramid. Now, the right-hand furthest picture is how this device works. At the surface, you have almost no damage. You might have a little bit of redness, you might have a tiny bit of pinpoint redness, possibly some pinpoint bleeding, but not usually. But underneath is where the magic is happening, because that pyramid, that energy spreads out. And now you're getting that coverage under the skin, which promotes new collagen, it promotes new elastin. It's a great technology for fine lines and wrinkles, for acne scar or facial scar reductions. It improves skin tone and texture, and overall skin rejuvenation. So that's how bipolar energy works. Has a 1 to 4 millimeter depth of penetration, so it doesn't go very, very deep. Depending on the settings used, and there's 3 different programs, A, B, and C. We typically, for most patients, use a C program. So they're going to have no downtime per se, but 3 to 4 days of social downtime. What is social downtime? That means it's coverable by makeup, and you typically don't see that the person had the procedure once they use that type of makeup. So that's how those two, the monopolar and bipolar devices, work. Next is multipolar, and as you can probably imagine, if we have monopolar and bipolar, 1 or 2, multipolar is more than 2. Typically it's 4, 5, 6. In the case of the Venus Freeze and Legacy, it's 8. So why is that important? Well, I'm going to bring up the next slide, and we're going to go through this. On the bottom of the page, and by the way, on the top of the page, for those who say, why did we cover that? It's because I forgot. This is live radio. That's actually a device called the VeloShape, and you can see there are 2 rollers in there. Each one of those rollers is actually an electrode for the bipolar mechanism of how the VeloShape operates. Now back to the other one, and you can see there's 2 pictures. One is a small handpiece, and if you can make that out, it has 4 electrodes. The next one is an octagon and has 8 electrodes. So if you're watching this at home, pretend, and let's go to the top left of that circle you see. Pretend that's labeled 1, and then 2, and then 3, then 4, then 5, then 6, and 7, then 8. I can program this device to fire those different electrodes, so I can either be between post 1 and 2, or post 1 and 6, or post 1 and 8. So the further apart the posts are, the deeper the energy is going. So through very complex algorithms and software, you can program this device to treat superficially or different depths of the fat. So I can go a few centimeters deep, I can go 15 centimeters, I can go 25 centimeters. All depends on the person. You know, a person that comes in that's in very good shape, who has not a lot of fat, you're not going to go as deep. A person who has a little more girth to them, who's got a higher BMI, you're going to go deeper. And this allows us to program multiple layers at once. So I can be, yes, I can heat the skin, and I can also heat the fat at the same time. And that's where these multipolar devices are so different than the previous generations of radio frequency. So the Venus Legacy and the Venus Freeze also incorporate a technology called magnetic field energy. And in the case of the Venus Legacy, it also has a vacuum, like the old VeloShape, but a little bit different, in that the vacuum also has electrodes inside the chamber where the skin or the fat is being sucked into. So now you're able to more effectively target and selectively target the areas that you're going over with these type devices. Very, very impressed with this, and like I said, in 2 weeks, we're going to have Steve Harsnett, who's one of the regional managers for Venus, to come on board, and we're going to dedicate the entire hour to this technology because it's that amazing. The Venus Freeze was a good machine. The Excelis Elite I thought was better back then. And by the way, again, these devices, you could start on an Excelis Elite, then graduate to a Vanquish, then graduate to a Venus Freeze, and then graduate to the Venus Legacy. Nothing works 100% of the time on the same patients. We had a couple sisters come in, and they both received the same treatment, but one had a better result on a different technology than the other. Now they're sisters. Why is that? Truth is, we don't know. We don't know why different technologies are required to get the best results for patients. Again, this is a practice of medical aesthetics, and as I like to say, and I've said this on this program a number of times, even a simple over-the-counter aspirin in patient 1 cures a headache. In patient 2, does nothing. And in patient 3, it causes a severe reaction that could be life-threatening. And that's a simple over-the-counter aspirin, which you can't compare to the technologies we bring into Forever Young Med Spa to provide the best FDA-approved technologies for skin tightening and body contouring non-surgically. Okay, the Excellis, the Venus Freeze, the Venus Legacy also have no downtime. Typically, you're going to get a little red, might get a little swollen, but that goes away quickly, and there's usually no downtime associated with those devices. The last technology for RF is called Focus Field RF, and there's only one technology in the world today that uses this, and it's called the Vanquish, which we also have. And the Vanquish uses this focus field radio frequency to address a large area. And Freddie, if you can go to the next slide, you're going to see on the left-hand side is a picture of this device. And it's kind of hard to make out, but it's got three pieces. It's got a piece that goes over the abdomen, and then two pieces that bend back and forth to go over the love handles. So you can treat an entire abdomen without ever touching the patient. And on the picture on the right is a thermal picture taken after the procedure, where you can see the amount of heat that this has generated deep into the tissues. Now, why is heat important? Heat is what actually kills the fat cells. You need to maintain a temperature of 45 to 46 degrees Celsius, which equates to all us Americans in Fahrenheit of 113 to 115. That actually causes what's called fat apoptosis, which is the destruction of fat cells. And that permanently kills those fat cells forever. That's not to say that if you go out and eat a bunch of bonbons, you're not going to get fat, because your body's always producing new cells. So once you go through these procedures and you've lost the inches, and the average patient loses about 2.5 inches with the Vanquish, it's not licensed to go out and start eating like there's no tomorrow. It's actually licensed to say, I've spent this money, I want to keep this result, and now the simple formula is, I'm going to burn more calories every day than I take in. It's no more difficult than that, ladies and gentlemen. It's very simple. So it's a great way to jumpstart a diet as well. But that's how these different technologies work. And by the way, on the 45 to 46 degrees Celsius, or 113 to 115 degrees in the fat layer that we're treating, the skin and muscle never get hotter than 38 to 40 degrees Celsius, or 100 to 102 degrees Fahrenheit. And as we all know, your skin does not burn. Even fevers get to 100, 102, 104. You're not going to burn the skin. And that's the magic of this technology, is you can tune to the fat layer. So we've gone through all four of these devices. It's time to take another short break. We're going to come back and talk about what's the common denominator for all these devices, and what's best, surgery or non-surgery, after the break. Thanks.
Turn back the hands of time with South Florida's #1 medical aesthetics center, Forever Young Med Spa. Have you ever wished you could turn back the hands of time? Lose those lines and wrinkles and enjoy the healthy, flawless skin you had during your younger years? Ever wanted to rid yourself from hair under your arms, on your legs, or around your bikini area? Or men, the hair on your backs? Well, now you can at Forever Young Med Spa, where we provide the latest surgical and non-surgical procedures and rejuvenation products to restore your youthful skin appearance and enhance your self-image. Under the direction of renowned board-certified plastic surgeon Dr. Jeffrey Lagrasso, our staff of highly trained and certified professionals will meet with you to go over your goals and recommend services that best fit your lifestyle, your budget, and your expectations. So no matter if you're looking for surgical procedures such as Vaser high-definition body sculpting, a mommy makeover, or non-surgical services such as the latest FDA-approved injectables, Vanquish body contouring, Excellis Elite for skin tightening, or our HydraFacial MD treatment for your face, you can relax and let Forever Young Med Spa complete your journey towards a younger, more vibrant-looking you. Call us now and schedule a complimentary consultation at 954-450-2626. That's 954-450-2626. Or for more information on all our services, please visit our website, www.foreveryoungmedspa.us.
Okay, good afternoon. Welcome back. So we've spoken about the different types of radio frequency energy and why we're probably one of the only centers in not just South Florida, but in the country that has all these 5 different devices. We're very proud of that because we really try to spare no expense in bringing back to our patients the best technology money can buy that's going to offer you the best hope of getting the best results. And those devices, again, are the Axillus Elite, the Venus Freeze, the VeloShape, the Vanquish, and the Venus Legacy. So let's talk about some of the most common denominators for all these different devices and what you as patients need to be aware of. Okay, so these are all commonalities of all our RF devices except for the Vanquish. So except for the Vanquish. First, know that all are extremely, and I mean extremely, operator dependent. So make sure your technician is both certified on the actual device and has at least a year of experience with the device, and that's critical to success. It doesn't have to be a year experience on one device if they've had a year experience on another device, because they kind of operate in the same manner. But radio frequency is different than laser energy. It disperses in a different manner. It heats up in a different manner. It treats everything in a different manner, so experience is key. All body shaping procedures and skin tightening treatments should feel warm to occasionally hot, but never painful. When you or the patient, or as a patient, are receiving a treatment, it's a joint responsibility to let your practitioner know when something's getting too uncomfortable. Don't be a hero. You don't want to leave and get a burn, because burns can and do occur. Now, they're not horrible burns, they're minor burns. But if it's on your face, a minor burn could be a 4-alarm fire, right? So don't be a hero with these technologies. Let the technician know that, hey, it's getting too hot to handle, and then they reduce the energy or move to a different area. So, enough said. Know that the treated area could be red for a few hours. You could possibly have bruising in the area, especially if you're using suction. Suction on the Venus Legacy it's a beautiful system, and you can adjust the suction from low to high with about a dozen settings in between. But that suction, especially in the inner thighs, in areas that are sensitive, could cause some bruising, so know about that before you get it done. But again, it should not be uncomfortable when you're having it done. If you're having it done and you're saying, ouch, ouch, tell them that they need to lower the energy or lower the suction. And it could be uncomfortable for a few days, especially if the vacuum is used. So know that when you touch it and you say, wow, it feels like I got a bruise, even though you might not see it, there might be an internal bruise, and it's normal. Know that no one, and I mean no one with a pacemaker, can have any RF treatment, radio frequency treatment, because that could interfere with the pacemaker, and we don't want that to happen. Anyone with an implant, let's say you come in and you have a implant through your nostril, through your lip, through any area of your body, we have to take that out in order to use RF. On the Vanquish, and I know we're not talking about it now, but just want to bring this to light, the Vanquish, because the field of RF is so vast, even patients that have like a hip transplant or a knee transplant, we have to be extra careful with. Knee transplant, not so much, but hip transplants we can't even do, because you have a run the risk of heating that metal transplant up and causing a burn internally. So check with your practitioner, and anyone with a hip transplant cannot use the Vanquish. Patients who have been exposed and have had a herpes outbreak in the past, if you're having a treatment done in the face, you have to be treated prophylactically with an antiviral to make sure that the outbreak is minimal or doesn't happen at all, because using heat in and around the face and around the lips can cause a hepatic outbreak. So know that. No unprotected sun exposure within 3 days of treatment. And I'll ask this question frequently, why it's not a laser? Well, it's not a laser, but it's putting in a lot of heat. Remember the analogy from a couple shows ago? I tried to have imagine, this is where radio is neat. I can have you picture this, if you will. A piece of cellophane, and under the cellophane is a match or a lighter. What happens to that cellophane? It starts to ball up and constrict. And that's how all these devices work with heat, is you tend to cause, that heat causes the skin to constrict to some degree. So that's how they work. And that's why with sun exposure, you don't want to go out into the sun, because even though it wasn't a light-based treatment, a lot of heat is still in your skin. You go out into 95-degree heat, you're adding more heat to the skin, and you could get a blister. Next is patient selection. The best patients for body contouring are patients that are within their BMI ranges and not obese. Again, this is not a weight loss type of treatment, although some patients do in fact lose weight, but it's not FDA approved for weight loss. Our treatments for the face typically require 4 to 6 months following the patient's last treatment for best results. Patients that come in for body contouring for any type of RF treatment have to be properly hydrated. And that means, and look, this is one of the most frustrating aspects of running this practice, is even when you tell patients they have to drink 8 to 10 glasses of water a day, and by the way, you should be drinking that anyway. Everybody on the planet should be drinking 3 liters of water every single day. That's the minimum. That's what you should be drinking. And they come in, and we have a scale that you can't cheat on, and it tells us how hydrated your skin and your body is. So when patients aren't at a minimum hydration level, we have to send them home because it's not going to work. That water is imperative to flushing out the fat. So if you're taking the fat, and you can picture a grape, and you're squeezing a grape, and all those lipids are going into your bloodstream, if there's not enough water to get that out of your lymph system, you're wasting your time. You're wasting our time. So patients have to drink minimum 10 8-ounce glasses of water per day, 3 days prior and 3 days after, to flush your lymph system and get that going. And recent studies have shown that the majority of patients getting these treatments are underhydrated, and we know that for a fact in our own practice. So next, we're going to talk about the Vanquish. And the Vanquish, patients undergoing a Vanquish treatment, even though the operator is not doing anything, they're setting and tuning this device, that wand, over the patient's stomach and love handles, and then they're simply monitoring it. And feedback is important between the patient and the practitioner to say, are you getting any hot spots? Is it feeling uncomfortably warm in any one area? Because if it is, we need to adjust either the frequency, the tuning, the power, or the placement of the pad, because we don't want anyone to get a burn. A common complication, when I say common, happens in about 10 to 15% of patients, is something called paniculitis. Paniculitis is when the fat cells die so quickly, and they die off so quickly they start to clump together. Typically happens again in patients who are underhydrated. So those patients that get paniculitis know that it will go away. Might take 2 weeks to a month. We pause the treatments during that time until there's no tenderness in the area where the paniculitis developed, but it will go away 100% of the time with time. But it is a complication. And I say complication, it's a known complication. When you're killing fat cells too rapidly, you get this condition, benign condition called paniculitis. And we have treated about 6 patients for that over the past 9 months or so. So proper placement of the spacer pad, which is about 2 centimeters from the patient's stomach, is very important to success. And we actually, with a new protocol, once we set that spacer pad, we remove it. We remove it because the spacer pad is made out of a fabric that causes the patient to sweat or perspire, and perspiration and sweating is the enemy of this treatment. You don't want any moisture on the skin, because moisture heats up and causes a blister. So we have fans that are pointed towards the patient's abdomen to prevent that, and we actually pause the treatment at 15 minutes and 30 minutes to wipe down and make sure there's no perspiration. So also the patient, when they're having a Vanquish treatment, now picture this device kind of just off your skin, and now you're laying flat on your back and you're breathing. As you're breathing, you're going up, and down and up and down. So we ask the patients to try and minimize their abdominal area from going up and down, and practice shallow breathing during the treatment so we can keep that energy focused on the fat layer as much as possible. So also, Vanquish patients and the practitioners have to be jewelry free during the treatment, because this again is a focused field radiofrequency treatment. It's over a larger area, and you don't want the practitioner who has her wedding band on all of a sudden getting a blister on her finger, because it has metal which heats up very quickly. So all gold has to be removed, and no cell phone usage during any of these treatments, because that can interfere with the treatment, and also keep you focused on something else instead of letting the practitioner know, hey, it's getting hot, and you need to lower the energies down. So that's the Vanquish. And again, we use fans pointed towards the area of where the abdomen love handles are to keep moisture at bay. So the question I'm asked all the time is, okay, you have all these non-surgical, you have all these surgical treatments, what's best? And the answer to that is it depends. Know this, and anyone who tells you differently is simply lying. Non-surgical treatments, all that we have, and we have the best money, best technology money can buy, are not the equal of surgical treatments. They're always going to be something less. Now, they still have a place, but if you come in and you say, and you're 55 years old and you have laxity in your face, and you say you want to be pulled back and you want to look 20 years younger and you don't want any laxity in your face, these non-surgical devices are not going to give that to you. They're going to give you a degree of skin tightening, a degree of improvement, but nowhere near as good as a facelift, whether it's lower, upper, combination, or combination neck and facelift. Patients need to decide what's best for you based upon your expectation of results, the affordability, the experience of the practitioner providing the treatment, anesthesia, post-care treatment, and time off work. In this day and age, I'd say 75% of the patients come in and say, I can't afford to be out of work. I don't want to undergo a surgical operation. I don't want to undergo anesthesia. I don't want recovery. I don't want pain. And I want something else. And that's where these non-surgical devices work well, and they do a great job. But if anyone tells you that they're the equal of a surgical procedure, go somewhere else, because you're in the wrong center where they probably don't even offer surgery. So there's a website, and we're going to get to this in a second. I'm up against a break again, darn it. So we're going to take a short minute break, come back after, and discuss a website that I think a lot of you, if you don't know about, you will soon. Check you back in the next minute.
Turn back the hands of time with South Florida's #1 medical aesthetics center, Forever Young Med Spa. Have you ever wished you could turn back the hands of time? Lose those lines and wrinkles and enjoy the healthy, flawless skin you had during your younger years? Ever wanted to rid yourself from hair under your arms, on your legs, or around your bikini area? Or men, the hair on your backs? Well, now you can at Forever Young Med Spa, where we provide the latest surgical and non-surgical procedures and rejuvenation products to restore your youthful skin appearance and enhance your self-image. Under the direction of renowned board-certified plastic surgeon Dr. Jeffrey Lagrasso, our staff of highly trained and certified professionals will meet with you to go over your goals and recommend services that best fit your lifestyle, your budget, and your expectations. So no matter if you're looking for surgical procedures such as Vaser high-definition body sculpting, a mommy makeover, or non-surgical services such as the latest FDA-approved injectables, Vanquish body contouring, Exilis Elite for skin tightening, or our Hydrafacial MD treatment for your face, you can relax and let Forever Young Med Spa complete your journey towards a younger, more vibrant-looking you. Call us now and schedule a complimentary consultation at 954-450-2626. That's 954-450-2626. Or for more information on all our services, please visit our website, www.foreveryoungmedspa.us.
Okay, welcome back. Next, we're going to talk about a website that I think everyone who's looking to get any surgical or medical aesthetic treatment done should probably visit. And that's called realself.com. That's REALSELF, S-E-L-F, not S-E-Elf. realself.com. And this is, by all accounts, they take the opinions of patients who've had these procedures done. And there's always room for a fudge factor, so I can't discount that, but this seems to be a pretty legitimate site for looking up what procedures are popular, what are getting the best patient reviews, and hearing and listening to, or reading, I should say, real patients, real results, real stories by real patients. So, we talked about surgical versus non-surgical, and I mentioned that those non-surgical treatments, although they're excellent and they do a wonderful job, are not the equal of surgical treatments. And you can see that on realself.com as well. And we're going to talk about that. So when reviewing systems or outcomes, keep a couple things in mind when you're visiting this website, which I'm recommending. But RealSelf currently does not differentiate between versions or generations of systems, so they're all lumped together. As an example, the Axillus is now called the Axillus Elite because they upgraded the platform with double the energy. But yet in the reviews, it's all lumped together, both the Axillus and the Axillus Elite. The Venus Freeze has been upgraded. It's a different platform, and the Venus Legacy is all new, but it's all lumped together under Venus Freeze. So you're going to get some good information and some older information, and you as the prospective patient need to cull through that to determine which one is best for you. Also, RealSelf does not differentiate on the surgical procedures between if the MD who performed the surgery is a board-certified plastic surgeon or something else. And again, and for those listening in for the first time, it's unfortunate, but it's true that it's definitely patient beware when it comes to selecting a surgeon, because any doctor with an MD designation can call themselves a surgeon and operate anytime they want to without ever undergoing a surgical residency or a plastic surgery residency, a fellowship, or passing board certification. Dr. LaGrasso is a board-certified plastic surgeon. That means he has an additional 7 to 8 years of education and formal training that a conventional MD does not. So, the ratings for surgical procedures on realself.com. Mommy makeovers, which typically involves a breast augmentation and or lift with a tummy tuck and lipo, has a 98% rating and tens of thousands of procedures. Very, very happy patient base. Tummy tucks, 96% rating. Facelift, 89% rating. And Vaser lipo, an 85% rating. Again, keep in mind that these numbers, especially when you come into the tummy tucks and the Vaser lipo, you have a lot of doctors who are not board certified plastic surgeons doing these procedures. Dr. LaGrasso is one of the best Vaser surgeons in the world today. So Vaser high def, Vaser body sculpting, Vaser smooth for cellulite reduction. He is and Brazilian butt lifts. He is the de facto guy. He is the best, in my opinion. On the non-surgical procedures, it drops down, as you would expect. Everything that's non-surgical is going to be something less than the result of a surgical procedure. The Vanquish has 81% patient satisfaction, the Venus Freeze 79%, the Axillus Elite 67%, and the E-Matrix 64%. Remember what I said earlier on RF devices. These devices are extremely, and I mean extremely, operator dependent. I can give 4 operators a device and say, on the same person, you do the arms, you do the legs, you do the stomach, and you do the face. And could have 4 different results. It's not the machine, it's the operator. It takes time, it takes experience, it takes tenacity, and in some cases it takes physical exertion, because when you're doing body contouring, especially with the Venus Legacy or the VeloShape, it's a laborious process for the person performing it. And you got to make sure that the person doing it is experienced. I can't emphasize that enough. So that's kind of it on the RF side. And I have, I have some studies I wanted to go through if I had time, and I think I have a few minutes. And one of the studies that caught my eye over the past few weeks, I've been kind of waiting to get back to the studio to discuss, is 5 reasons you still have acne. So reason number 1 is that you could be one of the unlucky 50% of women that in their post-teen years, according to the Academy of Dermatology, have hormonal fluctuations. And women, more so than men, or much more so than men, can have these during pregnancy, on off the pill, premenopause, postmenopause, premenopausal. Even when you change birth control methods, you can create hormonal imbalance in your body, and these pimples usually appear on the chin and neck or along the jawline. And as a quick fix, your dermatologist or whoever you're seeing can inject corticosteroids or cortisone, or they may talk to you about an oral medication that blocks the androgen hormones that are often responsible for that adult acne. Reason number 2, and I see this all the time, you're searching for the elixir of youth. So you're going to Burdines, you're going to Macy's, you're going to Bloomingdale's, you're spending hundreds of dollars on these products, and remember from a prior show, nothing you buy at a store, whether it's Sephora, whether it's Bloomingdale's, nothing can penetrate and correct a skin condition. So they're loaded with these heavy-duty moisturizers that look great lying there, but they typically can clog your pores and create acne. So look for products that are oil-free, non-comedogenic, don't have things like acne, don't have things like lanolin, squalane, alcohols, oils, mineral oil, coconut oil, butter oil, or sodium lauryl sulfate, which, by the way, is in almost every shampoo that you buy that doesn't say sodium lauryl sulfate free, contains it, and that's the ingredient, the main ingredient in power steering fluid that you're putting in your hair. So always look for products that don't have these type of things. You have adult acne. Okay, well, that means you might have perioral dermatitis, or a condition which is a condition common amongst middle-aged women that is often mistaken for acne and is a variant of rosacea. So typical things that can cause that are these emollient creams that you get over the counter, steroid creams, heavy face creams, and even fluoridated toothpaste can cause this. Typically appears as a red bumpy rash around the mouth or face, and it can typically be cured by a short course in antibiotics or anti-inflammatories. Here's one everyone can relate to. You're overwhelmed by adult responsibilities. Stress and exhaustion can cause your cortisol to spike, which can cause an increase in testosterone as well as pimply skin. According to the study that I'm kind of going through as live on the air here, is that when you have this type of condition, the stress candies, M&Ms and sodas and bags of chips and things with lots of sugar aren't helping because they have a very high glycemic index, which can aggravate and increase the acne as well. So try and avoid those. Don't rush out to get your teenage acne cream with 10% benzoyl peroxide. Use something a little less strong because your skin is thinner as we age and you don't need that kind of horsepower. Lastly is your recently renovated powder room, which means that you've got a new bathroom and new high-powered mirrors, and you're looking out and you're seeing all these different imperfections in your skin, and then you decide, I'm going to take care of this myself. I'm going to get out this little switchblade, I'm going to pop out this pimple, and you cause acne scars. And that's very common. We see this all the time. The good news is we have Fraxel lasers and lasers that can fix that or minimize that appearance. But please don't take, medicine into your hands and take out these little devices that pop out pimples. Let an esthetician or a dermatologist or your practitioner do that, because it's not the way to go. So that's it for this study. We're almost at the end of the show, and wanted to close with this. I open with this, which is kind of about, and I never discuss my personal situation with anyone. I'm a very private person. I've got some friends who are very public people that when we go to dinner with them, I'm always shocked about how many times people come up and say, "Hey, aren't you? And can I have your autograph?" and that kind of stuff. And I thought, geez, I'd never want that. Thought about doing my own TV show and virtual reality show been offered, and I turned them down because I don't want that kind of notoriety. I don't want people coming up to me all times of day and night and saying, "Aren't you?" I value my privacy. So getting back to the situation and why we were out for the past few weeks, I found this little saying on Facebook, and I want to read it for you. And it goes like this. It's been said that everlasting friends go long periods of time without speaking and never question their friendship. These friends pick up the phones like they just spoke yesterday, regardless of how long it's been or how far away they live. And they never hold grudges. They understand that life is busy, and you will always love them, and they will always love you. And that's what I want to go out with, is we had a crisis in our family, and it was nice to know that people we haven't spoken to in many years reached out to us with what can we do, how can we help, and for that, Diane and I are forever grateful, and leave it at that. So next week, folks, we'll be back with another show, and this time we're going to talk about a new technique for injections that is patented, and I think is going to be very educational. So until then, enjoy yourself, South Florida, and stay safe.
Thanks for joining Brian Sedella, president and founder of South Florida's #1 medical aesthetics center, Forever Young Med Spa in Cooper City. Join us next week as Brian will again demystify the world of medical aesthetics and provide you, our listening audience, a non-medical opinion on what's hot, what's not, and what really works. You can contact Forever Young Med Spa at 954-450-2626 or visit our website at foreveryoungmedspa.us.